Okay, so those of you guys that have not had another class with me, you know I'm pretty obsessed with Border Collies, so no shock here. So today I'm going to be talking about some of the common diseases and health problems that affect them. And so here we go. So I'm going to go over 5 problems: hip dysplasia, which, as she talked about in the last presentation, is one of the most common genetic defects that affect dogs in general, and it's #1 for Border Collies as well. Second is Collie Eye Anomaly, which affects only about 2 to 3% of Border Collies, but it still affects them greatly, and it's more prevalent in some of the other breeds, but it's still a problem. Next we have Neuronal, Ceroid, Lipofuscinosis. I'm just going to call it NCL from here on out because it's obviously terrible to pronounce. And we have trapped Neutrophil syndrome, or TNS, and these are both lethal genetic disorders that so you can get like tests for them before with the parents to see if the puppies will have them, so it's kind of important for prevention. And last we have epilepsy, which we all know about. So hip dysplasia, what is it? Basically, hip dysplasia is when you, sorry about that. So basically, it's where the hips fail to when they're young, that it fails to come together correctly, and you can, in the future, you will actually have more problems with deteriorating, which leads to loss of function of hip joints. Some of the symptoms can be legs that will be more narrow in the back. They'll have a deeper amount of muscle in the front, so that because they have more pressure on the front, they will have decreased muscle in the back because of the decreased muscle in the front and not using them as much, or just kind of problems getting around, obviously, loose joints, some grating noises. What causes it? As I said, it's genetically transferred, so this means that some animals are more susceptible to it in the beginning. However, some other things can cause it, such as poor diet or obesity, weight gain, and they can just exacerbate the problem. What treatments are available? Well, there's several options. You can get surgery, obviously, but it's kind of a last-ditch thing. You can even get surgery known as the TPO surgery and the GPS surgery on younger dogs. That's a more preventative measure instead of when they're older. And that'll, some of them, the TPO rotates the socket of the younger dog. And we can also do physiotherapy, of course. An important one for that would be swimming, because you don't have any weight on the animal's limbs. Specialized diets are also important, and as I said, total hip replacement can be a last-ditch thing.
I will interject here that I remember reading about a study they did in, I want to say, Switzerland, where they, most of those European countries have very controlled populations. Sometimes you have to have a license to breed dogs. And they did a selection study, I want to say it was on German Shepherds, and they didn't breed any dog that had even showed any signs of hip dysplasia. And it was amazing. They charted out the incidence of hip dysplasia, and I think it was over 20 years, they decreased the incidence of hip dysplasia in the population dramatically. And I can't remember the number. What was it, like maybe from 50% to 20%? It was something very dramatic. And it brings up the point of that, I don't know if everybody's familiar with that genetic formula where you have phenotype equals genotype plus environment. And that's one thing with hip dysplasia. It's not all genetic and it's not all environment. It's like an interaction. So you can select against it, but you could still have it because of, you're making them jump up and down high distances and all that kind of stuff. But there's a strong genetic component to it.
Yeah, Border Collies are especially affected, especially because of the way that their gait is, especially when they're stalking, or not, well, they call it stalking, when they're herding sheep and whatnot, because they actually have more like a feline motion, so it kind of creates more problems for them, especially. So Collie Eye Anomaly, yet again, what is it, and how is the animal affected? Well, the chromosomes, specifically chromosome number 37, is what's mutated, and this affects the, I'm not sure how to pronounce it, Ceroid, which is a collection of blood vessels that absorb light and nourish the retina, and this has problems. So this mutation can cause other eye effects, such as retinal detachment, or a columba, which is a hole in the lens, choroid, or retina, iris, or optic disc. And so unfortunately the treatment for this, there is no specific, it's just like a lifelong thing. After you get it, there's no going back, except you can have surgeries for something like the cholo the what is it? A cholomba, and that can sometimes minimize the effects of that, but you can never really get rid of it. Next we have NCL, and this is a little bit more interesting. It's a neurodegenerative disorder that is always inherited as an autosomal recessive trait, and so basically the changes occur in the central nervous system, and it causes mental instability in the dog as well as some other more locomotive problems. Some of the symptoms can include serious behavioral abnormalities as it affects the brain, visual impairments, slight motor disorders, and these are usually the things that prompt the owner to take the dog to the vet, because a lot of times they won't know what's wrong with their animal, and they just notice kind of, strange behavior, and by the time they get there, obviously it's too late because this is not a treatable disorder. But it's, as the dog gets older, and some of the more late to terminal stage dogs may have more visual problems, very serious motor problems, and a lot of behavioral issues because of the brain dysfunctions.
Now I got a question. The image, is it like? Can you explain the image maybe a little bit?
It's a scan of a brain of a dog affected by it, and I wasn't exactly sure what we were seeing here with this. All I know is that since it's affecting the brain, it's probably just some kind of abnormality with that.
Well, the name almost sounds like
help.
maybe it's a collection of lipids in neurons. I'm not familiar with the case, but I mean, I think that's maybe what they're trying to show. I don't know, but it's totally. Once an animal's diagnosed with it, there's no treatment because it's in the brain cells.
Yeah.
And
Unfortunately, it's
so
not.
you would mark that animal for non-breeding, basically, if it was diagnosed, or you try to get it out of your breeding line.
They said that they won't last very long once they are, especially a more like late stage. It's kind of a lot like cancer. They pass pretty quickly.
Okay.
So next we have TNS, which is actually a disease that is, or I guess an inherited disorder affected only by Border Collies themselves, and this is where it's a hereditary disease that only affects the bone marrow that produces neutrophils, which are white blood cells, and however, they're unable to release them into the bloodstream. So in a way, this is kind of like a version of AIDS, meaning that the dog has an immune deficiency after this, and unfortunately, only puppies are affected by this because with an impaired immunity, they really can't last very long, so they're going to get other diseases, other problems, other infections. And so the symptoms are actually, you can't really define them because usually the dog ends up dying of an infection, not the disorder itself.
No, because I've never heard of that, but the name is neat because trapped means the neutrophils are trapped in the bone marrow and they want to get out to the blood, because one thing that you know about neutrophils, they're very prevalent and they're phagocytic. They're the first EMTs at the site of an injury. They're very short term, but there's a lot of them, and they're very phagocytic, but they're like the first responders, let's put it that way. And if they're trapped in the bone marrow, then you alluded to the fact that those animals have trouble healing wounds, because any animal or people with low neutrophils have trouble with wound healing.
They said that very few of them last into adulthood because it's just, the puppies especially are susceptible to infection anyway, and then once you take away their immune response, they're...
And can you imagine how subclinical that would be? An animal could be fighting an infection and you won't know it until it's too late.
Would you even be able to vaccinate them?
Oh, no. Okay, that's a great question. The question was, would you be able to vaccinate them? Absolutely not. We should get, when we do some immunology stuff, we'll talk about that. But no, it's very important white blood cells, and they're trapped in the bone marrow. There's nothing really you can do.
It's kind of an up-and-coming thing that they're researching right now. Not a lot is really known about it, so they're really trying to learn more about it so they can possibly try to help out. But as you said, there's not much you can do for them, unfortunately.
The neutrophil is very important. It's a white blood cell, but it's short-lived, but there's a lot of them. And by the way, another thing is, if you ever have a wound or you see an animal with wounds, you know pus forms, right? Do you know pus is mostly white, is the neutrophil with some necrotic tissue. So pus is really mostly neutrophils. So those animals, and there are other animals that have trouble with neutrophils, they always have trouble making wound healing, I should say.
I know like for immunosuppressed people, they give them like a white blood cell injection. Could you do that for these like
Well,
dogs to
yeah,
help
the
them?
question is, could you give them white blood cell injections? Yes, but that's short term.
Right, you have to continuously.
You'd have to, and then you're talking about costs that are warranted for people, but not for animals. Excellent questions.
So we have one more slide. Of course, most everybody knows what epilepsy is. So it's a neurological disorder that causes dogs to have sudden and possibly reoccurring seizures. Researchers can classify them usually as three different types, which is focal or partial seizures, so that's usually localized to one area, generalized or grand mal seizures, and focal seizures with secondary generalization. Now, once the seizure begins, as we all know, the dog will fall on its side. It will probably chomp its mouth. It may urinate, defecate because it's lost control of those systems, as well as vocalize and probably thrash its legs. So these can go on for about 30 seconds to 90 seconds or even longer, but usually it's about 30 to 90. And the recovery following the seizure may be immediate or it may take up to 24 hours. And some of the causes of epilepsy include eating poison, which I did not know that it can cause that, low or high blood sugar, or more serious things like strokes or brain cancer or liver disease. And lastly, the treatments, it's kind of a little bit more difficult to treat, but you can give medication to the animal to kind of prevent uncontrolled brain activity. I'm not sure what that was, but you can also strengthen the brain and the liver, some of them with a few of these drugs. There was one called Cholodin drug, and I'm not exactly sure what it does, but I know that it, and some of them like help with the vitamins and whatnot to help kind of balance them out, and avoiding toxins and providing a stable environment for animals like that so they're not under too much stress.
You ready for questions now? Any questions on those 4 topics? Are you saying this is genetic too for the collies? I mean,
it's just a really prevalent problem.
okay, it's a prevalent problem with the border collie population.
Is there a certain age in border collies that it shows up in more or so, or?
I have no idea. I'm not gonna lie to you. I have no idea.
That's fine.
Yeah. And I almost had a dog with epilepsy, I guess, in giving seizures. Do you know what they treated the animal
It
with?
depends on, usually if they've only had